Hi, today we are going to be talking about blood pressure. Now, if you think about the blood vessels as a highway, taking nutrients from point A to point B, then the blood pressure in your body is like the congestion of that highway. High blood pressure means there is a traffic jam, and it's hard to get through. Low blood pressure is like an empty highway, where there is nothing around. And if the blood pressure is just right, it's like a smooth ride on 275. As a CNA, which is a certified nurse's aide, I deal with my patients' blood pressures constantly changing. And if the change is drastic, it can cause serious harm to the patient. We are going to go over blood pressure and what it does, the highs and regulations, and the lows and regulations. High blood pressure is the pressure the blood has against the blood vessel walls. It regulates the oxygen and the nutrient distribution throughout the body. And low blood pressure, I will go over in just a moment. Normal blood pressure is 120 over 80. The top number is the systolic, which is what the blood pumps out. And then the bottom number is the diastolic, which is the resting. Now, pretension is the onset of high blood pressure. That is when doctors get kind of leery about if you are going to develop high blood pressure. Stage 1 hypertension. That is the first stage of high blood pressure. It is when lifestyle changes are considered and medications are introduced. Hypertension stage 2 is extreme high blood pressure, and that is when lifestyle changes must happen and you are at extreme risk for stroke or heart disease. The highs and regulations. 20% of people have high blood pressure. High blood pressure cannot be cured, but it can be treated with the medications and the lifestyle changes. The lows and regulations. Low blood pressure has the symptoms of blurred vision, nausea, thirst, cold, clammy, pale skin, fatigue, lack of concentration, dizziness, or lightheadedness. It is usually caused by pregnancy, low blood volume, or extensive amounts of time of bed rest. Low blood pressure can be treated by intaking water and salty foods. The salt in the foods act as a sponge in the body. It retains the water, and the water helps prevent dehydration, and it helps with the blood volume. The more water in the blood means that the higher the blood volume and the higher the blood pressure. High blood pressure is dangerous, but low blood pressure is also dangerous because if you have low blood pressure, you're not having blood go to your brain, which is just as serious as high blood pressure. We have gone over blood pressure and what it does, the highs and regulations, and the lows and regulations. I hope you have learned a little bit more about blood pressure and what it does. Are there any questions?